Hey, it's Dr. Jarret. I'm your board certified pediatrician here to help you parents out there get better health and take better care of your child. And I do this through my books, my live stream show, 2 Cents Tuesdays with Dr. Jarret, and other programs I have forthcoming. All I want you to do is have your friends like the Dr. Jarret page. Come to the page and like it. So, a lot of things in the news. I've had a number of journalist requests for some stories that we've been talking about recently. Some of them have been in regards to teething, stooling patterns in infants, some sleep pattern changes. So make sure you check all those articles out. If you're having any issues with your kids in regards to those topics, my feed almost has a new story that I was featured in almost every day. So just make sure you're paying attention to that. You never know when you may have a question, and it's right there in front of you. So I try to bring you everything that they're asking me about right away. Hey, Paulette, thanks for tuning in today. Hey, Asher, thanks for tuning in. So I also just wanted to talk briefly. I know we did a whole episode on gun safety before in the fall, but there was another school shooting that happened just today in Maryland. And if anything I can say in regards to this topic is that if you have guns in your home, please keep them unloaded and unlocked so your kids can't get into them and maybe cause harm with themselves or harm with other people. So make sure if you have guns in your home, keep them unloaded and locked. Keep your ammunition locked in a separate place from the actual firearm. That's very important. As you know, we had a very tragic shooting last month, and now there's another one today. So just a public service announcement. If anything, if you have guns in your home, make sure that they are locked up and the ammunition is away from the gun. So it's in two separate places, locked up, an unloaded gun. All right. So as we go on today, next week we'll begin season 2. So I know I'm excited with that. I'll have a few new things. I got lots of great categories from all of you guys out there. And you guys can continue to just make some comments, put some things out there to let people know that if there's a topic that you want to talk about and have it aired live on 2 Cents Tuesdays, then we'll do it. Just put it out there. Hey, Jamila, thanks for tuning in today. So, today we're talking about anxiety. And for those that don't know me, I'm Dr. Jarret. I'm your board certified pediatrician. I'm here to help you take better health of your child as well as get better control over your child. I do this through my books, my live stream show 2 Cents Tuesdays with Dr. Jarret, as well as a number of other programs I'm going to be rolling out to you very soon. This will happen to start during season 2. So all I ask you to do is just ask a few of your friends to come over to the Dr. Jarret fan page and like that page. And they should really get something out of it too. So that's spell out Dr. J-A, 2 R's, E, 1 T. So today we're talking about anxiety. And anxiety is something that's very, very common in childhood. And really can happen throughout. I mean, there's a natural phase of separation anxiety, what we see in young infants, where the mom or dad leaves and the baby gets very upset or nervous about it. That's a pretty normal developmental phase. So we're not really talking about separation anxiety, but anxiety can pop up in a number of different areas in a child's life, from a older toddler to young school-age kid, all the way up through teens and young adults. So anxiety should be addressed, and parents often ask me, well, what's going on with anxiety? How do I know about anxiety? And how much anxiety is too much anxiety? Because, well, anxiety, let's face it, is a natural feeling that most people have at some time of their life. Could be before they have to make a big presentation on stage or a big sports team performance. So there is a little bit of nervousness and anxiety in everyone. However, there is a issue with anxiety if it starts to interfere with daily life. Now, Asher says that her puppy helps with her anxiety. Yes, lots of good ways, including therapy pets, that you can help deal with anxiety, and we will get to that. So thanks for your comment there. But a few signs to look out, and if your child seems to have Jamal says he has anxiety over his NCAA March Madness bracket. Me too. Mine is blown already. So I don't know what to do with that. So does your child seem like they're excessively worried about a number of situations or activities? So not maybe the first day of school type of thing, but it could be something that seems to be a routine event. And if that anxiety seems to get heightened every time, that may be something to have a discussion or to monitor with time, so you can see exactly where the anxiety is coming from. Another thing goes in regards to the sleep patterns and how well does your child sleep. Does their anxiety seem to keep them awake at night or not having restful nights of sleep? Restful nights of sleep and not getting enough sleep can actually exacerbate the anxiety symptoms for the following day. So they kind of feed off of each other. So if they're having a mind that's racing a lot of the time, I think that there really could be something that could be causing that anxiety. Then they're getting sleep deprivation. Then the anxiety is getting worse. So pay attention to those sleep cycles. Do you think the anxiety has been happening over a long period of time? So it really depends on how long of a time that the anxiety has been going on. Is it just, a couple weeks, and is it maybe around a significant event like perhaps a minor fender bender or a traumatic event they witnessed at school, or perhaps even a traumatic news story? There's been plenty of that recently, and young children especially can be traumatized and become anxious over the media. So be careful with the media exposure. So we're looking at a longer duration of time. So we're looking at 6 months or so if these signs of anxiety kick in there. And if they seem to have some of these symptoms for over 6 months of time, that is probably going into the category of a more persistent anxiety. In addition, they must exhibit these symptoms more than, let's say, 3 to 4 days a week. So if they're having them 3 to 5 days a week or more, they could be having some symptoms of anxiety and may need some sort of treatment. So, of course, in teenagers, you're always worried about school performance and really throughout school-age children. So if you're seeing a drop in school performance, if you're seeing a decrease in their athletic performance, if they're involved in athletic activities, or if they seem to be able to just get worked up so much around these athletic activities or tests in school, particularly with all these standardized tests they have to take, that puts a lot of pressure on the kids. Then these are things that start to interfere with their life. And so again, we need to watch and ensure that they're not having these difficulties based on anxiety alone, or is it just an episodic thing? And then anxiety disorders, we're learning more and more about them, that they can run in families. And so if there are parents or cousins or other relatives in the family that may have anxiety or suffer more severely with anxiety, these kind of symptoms do run along family lines in some instances. So that's another thing to keep in mind. So the first step is really just to have a discussion with your doctor about this. If you think that your child may be anxious about any of these things, because there's a number of different ways that you can go about to take care of the anxiety in the child. One of the things that I would suggest is just having that conversation and perhaps getting into counseling for school-age kids, or behavioral therapy, which is also very effective for younger kids. Now, Asher already mentioned that her puppy provides therapy, so there are therapy dogs. There are a lot of very harmless ways to intervene and look at anxiety. So it really depends on the child, it depends on the circumstance, and it depends on how severely it's affecting the life. So people typically don't bring up these types of disorders with their physician because they think immediately we're going to go and give a prescription for some sort of pill and go on from there. But there's a lot of different ways that you can treat anxiety. So, and many of them are without medication. So they don't need a prescription. They don't need to take some sort of medication. And it could be something as easy as a therapy pet, for instance. So going through a series of counseling and things, and really understanding that the last resort would really be medications. Now, if they already suffer from another type of behavioral disorder, perhaps like ADHD, or if they're having some symptoms of post-traumatic stress disorder, then it may be more likely that they'll need a medication as a part of their regimen. However, counseling, however, behavioral therapy, play therapy, all of these types of therapies should be a mainstay of the intervention. So it should be something that could help get over the immediate portion, or it could be something that needs to be going, for 6 months to a year or even longer. It depends on the kid and the situation. Sometimes they will rebound and understand the sources of their anxiety, and so they'll stay away from some different types of triggers. And a lot of times it just takes a little bit just to take the pressure off themselves, particularly with academic and athletic performance. A lot of these very high functioning school age kids and preteen kids really get into that. Now, this also goes along to those children that may be gifted. Gifted kids tend to have a higher likelihood of developing anxiety, and this is just because they're always challenging themselves and pushing themselves and going on and on and on with different types of really superior coursework. They really try to perform in athletics very well, so they get all of these things going on, and it keeps them going to the height of their ability. And sometimes that's just a lot of pressure they put on themselves. Not to mention, gifted kids do have a higher likelihood of using alcohol and drugs in their teenage years as well. And this is thought to be just to quiet their mind because they seem to have a very active mind with times. So all of these things can go on in the background of anxiety. And it is something that's extremely common at different age groups and throughout life. So that being the case, you're going to know is one of those things. Now, Asher thinks that her dog is broken sometimes, though, because perhaps that anxiety is there a little bit more often than not, and it really may need more than just a pet, more than just some counseling. It could go on with a number of other things. So, wanted to talk a little bit about anxiety as we're ready to launch season 2, and season 2 is going to have a lot of great new things, a couple of guests that will be setting up some new topics for you guys. So this will be a great time for you guys to learn a few more things. So as always, if you guys have a question or concern after this broadcast today, just put it in the chat and we'll take care of it. Remember that anxiety is something that is normal. It's a type of nervousness, if you will. However, if it starts to affect your child so they can't do their everyday activities, then that's something that you may want to have that discussion with your physician to look into perhaps some behavioral therapy, play therapy, a counselor, any number of different things. But that's all it takes for many kids. So, thank you guys for tuning in. As always today, I'm Dr. Jarret, your board certified pediatrician, here to help parents get better health of their children and better behavior. I'm doing this through my books, my live stream show, 2 Cents Tuesdays, every Tuesday at 1 p.m. on Facebook Live, as well as some other programs I'll have rolling out during season 2. So make sure that you ask a friend to come over to the Dr. Jarret page and like it. I'm sure there's something that they may want to learn or know about their own children as well. So until then, thank you guys for tuning in, and I'll see you guys next week.